My hips kind of lock up, and it's really painful to walk on my leg when they do. Do you have any tips? And typically when people have hip issues, while you can have hip joint issues and subluxing hip sockets, so I have a history of hip dysplasia, I've had my hips reconstructed, and so hip joint issues tend to be more of a growing pain. Most hypermobility hip pain that I get or I see tends to be this outside of your hip kind of thing. That tends to be more of what we call a sacroiliac dysfunction or an SI joint issue. And when that spasm, so either when the joint locks up or when your muscles spasm and don't let you move, it can make it feel very stiff, very dysfunctional, and very painful. So a couple of things that you can do or that you can try. One is what we call a figure 4 stretch. So example of that, so here you're going to cross your foot over your knee and just sit up tall. There's a lot of pictures of this out there that show leaning forward and doing all this. You don't need to do that. Just roll your hips forward so that way you get a stretch in the outside of that hip, and you do it both sides. So what you're looking is for those to be equal, not one side really tight and one side not too bad. You want to kind of just hold that position, allow it to relax in. Second thing you can do is heat. Put heat right across your glutes and allow those muscles to relax. And third, lie down. So lie down, put your feet up, get the weight off of your back, and that can be helpful as well. Lastly, I have a technique I teach my patients a lot so that they can address things at home if they come up, and I like it because it's safe. If you don't need it, it's not going to hurt you. If you do need it and it's helpful, great. You can try it and see if it'll be helpful for you. So I have someone who's going to help me demonstrate so that way you can understand. Now for this, it's known by different names in different treatment realms. Kind of in my world, it's known as what's called a pubic shotgun. And so what you're going to do, I'll stand over here, is you lie down and you have someone help you. You can do this with a belt, and there's ways you can do it by yourself. But if you're going to have someone help you, just make sure that you are in control of your movement and that you don't have someone else overpowering you. So what she's going to do is she's going to push her knees out to the side, and my job is just to keep my hands here and not let her move. So go ahead and push your knees out, and I'm just trying to match her pressure. I'm not trying to overpower her. And go ahead and relax. And she's going to push out for about 5 seconds. Now, when you're doing this, if that's hurting, don't push that hard. You want to do it to try and activate those muscles because this helps your muscles to self-correct your pelvis if it's an alignment issue. So then we're going to bring your knees out a little farther. You're going to do that again. So go ahead and push your knees out to the side. Again, I'm just matching her pressure. I'm not overpowering. And then relax. So another 5-second hold. And then what you can do is you can make a fist. You can roll up a towel, use something that's got a little bit of give to it but is also firm, and then go ahead and squeeze your knees together as hard as you can, and then relax. So you do 2 out, then do 1 in. It's not unusual to have something pop with doing it. It is pretty controlled because you're just using your muscles, and your hips should be able to go out and they should be able to come in. And you are in control of how much force you're using the whole time. If it pops, that just means it's something adjusted, and that's actually a good thing. Then you get back up and see if you feel better, see if you can put more weight on your leg. If it doesn't pop, that doesn't mean it didn't help. You still are going to stand up, move around, see if that helps your symptoms. So hopefully that might help some of you if you are having that hip outside kind of hip pain issue.